In our last section, we have studied about the malaria life cycle of Plasmodium, typical symptoms associated with malaria, its diagnosis, treatment and prevention, and we are going to study Leishmaniasis in this section in detail. This is a protozoan disease transmitted by sandflies, which inject infective promastogotes that adapt to survival in cells of the reticuloendothelial system as amastogotes. Leishmania donovani is the cause of Kala-Azar, that is visceral Leishmaniasis. The life cycle of Leishmaniasis involves a variety of mammals such as human beings as reservoirs. The life consists of two important stages. The first one is the sandfly stage, and the other one is the human stage. Only female flies are vectors because only they take blood meals. When the sandfly sucks blood from an infected host, it ingests macrophages containing amastogotes. After the dissolution of the macrophages, the freed amastogotes differentiate into promastogotes in the gut. They multiply and then migrate to the pharynx and proboscis, where they can be transmitted during the next bite. The cycle in the sandfly takes approximately 10 days. Shortly after an infected sandfly bites a human, the promastogotes are engulfed by macrophages, where they transform into amastogotes. Amastogotes can remain in the cytoplasm of macrophages because they can prevent the fusion of the vacuole with lysosomes. The amastogotes divide in the midgut and migrate to proboscis. The cycle is completed when the fly ingests macrophages containing the amastogotes. The pathogenesis of Leishmaniasis comprises of several steps. In visceral Leishmaniasis, the organs of the reticuloendothelial system are the most severely affected. Reduced bone marrow activity, coupled with cellular destruction in the spleen, results in anemia, leukopenia, and thrombocytopenia. This leads to secondary infections and a tendency to bleed. The striking enlargement of the spleen is due to a combination of proliferating macrophages and sequestered blood cells. The marked increase in IgG is neither specific nor protective. Kala-Azar occurs in three distinct epidemiologic patterns. In one area, which includes the Mediterranean basin, the Middle East, southern Russia, and parts of China, the reservoir hosts are primarily dogs and foxes. In sub-Saharan Africa, rats and small carnivores are the main reservoirs. A third pattern is seen in India and neighboring countries in which humans appear to be the only reservoir. So, what are the symptoms associated with Leishmaniasis? Symptoms begin with intermittent fever, weakness, and weight loss. Massive enlargement of the spleen is characteristic. Hyperpigmentation of the skin is seen in light-skinned patients, Kala-Azar meaning black sickness. The course of the disease runs for months to years. Initially, patients feel reasonably well despite the persistent fever. As anemia, leukopenia, and thrombocytopenia become more profound, weakness, infection, and gastrointestinal bleeding occur. Untreated severe disease is nearly always fatal as a result of secondary infection. Following is the laboratory diagnosis of Leishmaniasis. Diagnosis is usually made by detecting amastogotes in a bone marrow, spleen or lymph node biopsy or touch preparation. The organisms can also be cultured. Serologic tests are positive in most patients. Although not diagnostic, a very high concentration of IgG is indicative of infection. A skin test using a crude homogenate of promastogotes as the antigen is available. The skin test is negative during active disease, but positive in patients who have recovered. Now let us talk about the treatment of Leishmaniasis. The drug of choice is either liposomal amphotericin B or sodium stibogluconate. With proper therapy, the mortality rate is reduced to almost 5%. Recovery results in permanent immunity. The prevention involves protection from sandfly bites by use of netting and protective clothing, insect repellents and insecticide spraying. That is all about Leishmaniasis. Stay tuned to sqadia.com to watch more knowledge-filled videos.